Hello, today's lecture is on geriatric rehabilitation. I'm Dr. Janice Huntingford. You have heard me before. You already know who I am by now. So we'll just dive right into geriatrics. I would say that most of us treat geriatrics in our patients. The question is, what really is a geriatric? Well, for the dogs, as you can see on the left, it's about 75% of their expected lifespan. And we look at it like that because there's such a variation. Obviously, a 5-year-old Great Dane, 5'6", is a geriatric, as opposed to a 5-year-old Chihuahua who is simply middle-aged. With cats, we consider cats as being geriatric at over 12 years of age. When I think about geriatric medicine, I think about geriatrics as being old but healthy, or old and having some subclinical organ dysfunction, or ones who actually have overt disease and multiple problems. So how I'm going to treat them with rehabilitation is going to depend an awful lot on whether they're in category 1, 2, or 3. Aging changes cause something called sarcopenia. And sarcopenia is muscle loss. Obviously, the Arnold Schwarzenegger on the left side is our young Arnold with lots of muscle, as opposed to the one on the right who has geriatric sarcopenia. And when you age, you're going to lose mostly the slow twitch fibers, which are the type 1 fibers. Now, in muscle loss and number of sizes of fibers, humans are going to lose 5% of the muscle mass per decade of life, and that's going to increase after age 65. So, sarcopenia, how does this affect our pets? Well, the rate of sarcopenia in aging pets, we don't really know, but it's likely much higher because of their relatively shorter lifespan. If you look at the picture, this is actually the same cat. The picture on the top is the cat at 2, and the picture on the bottom is the cat at 14. So sarcopenia, or muscle loss, is common in our pets that have chronic kidney disease and chronic heart failure. And it tends to be a predictor of mortality. The World Small Animal Veterinary Association actually looks at something called muscle scoring, and they think that that is a very important thing to look at, and it's one of our vital signs. So aging pets, what do they need muscles for? Well, obviously they need muscles for standing and climbing onto the bed and posturing to eliminate. And these animals really need to have enough mobility muscles to keep them going. If they have decreased mobility, they're going to have more euthanasia. So this is why we're concerned about muscles with our pets. This is a muscle condition scoring, chart, really. The top picture on your left is showing no muscle wasting. So when I'm scoring muscle condition scoring, I'm scoring it out of 3. And the top with no muscle wasting is a 3 out of 3. With mild, it's going to be a 2 out of 3. Moderate is going to be 1. And then when you have marked muscle wasting, that is a 0. Now, the World Small Animal Veterinary Association, if you go to that association's website, they have all kinds of interesting pictures about how this works. And they will be testing the muscle conditioning scores over the skull, over the scapula, over the spine, and also over the pelvis. Because when we do body condition scoring, which we need to do for all of our pets, it doesn't really take into account muscle wasting. So if a pet is losing weight, I want to know if they're losing fat or if they're losing muscle. And oftentimes, if they're losing fat, then that's okay. But if they're on a weight loss diet and the diet is not high enough in protein, those pets are going to lose muscle. And they need those muscles in order to maintain their normal activity and in order to be able to posture to urinate, get up and down off the bed, and move around. Once they lose those muscles, then a lot of them are going to lose their life. So I'm a huge proponent of using true weight loss diets that have higher protein as long as the kidneys are good and can tolerate it. Because the only two things that build muscle are exercise and branched chain amino acids, so protein. So let's look at some other aging changes. Just like humans, as dogs age, they're going to lose proprioception and balance. They're going to have a decrease in tissue elasticity, and they aren't going to have as much range of motion as they had when they were younger. And oftentimes these animals are painful, and they're going to have pain from degenerative joint disease. This particular hip, as you can see, is terrible. And as it says, often obese animals. This animal was pretty obese. We will look at him a little bit later. But as you can see, he has bilateral hip dysplasia. And you can believe that every time this pet's walking, that it's painful. So here's what we see with a typical geriatric patient. And this is one of my patients whose name is Cooper. And Cooper is actually wearing a help him up harness. That's what this is right here, because he has weakness in his back legs. So this help him up harness has a handle here and also a handle back here, so that his 82-pound owner can help him get up and down off the stairs by helping, to pick this up. But when Mrs. Client is looking at Cooper, this is what she sees. She sees him slowing down and reluctant to jump and sleeping more. He can't do the stairs. And she's looking at that and saying, I think he's just getting old. Well, not really, but she's worried because, sometimes he's confused. So she's very worried about his quality of life. So that's what the owner is seeing. And these are the things that I'm finding with a lot of the typical geriatric patients, and I did find these with our friend Cooper, that he had some arthritis. And then when we have arthritis, we often have painful muscles and joints. And we can have deficits, neurological deficits, that will manifest by the dog scraping and scratching their toes along the ground, and that's what the clients see, and they're concerned about that. Muscle weakness, this guy, if you're looking at the difference between just a straight orthopedic problem and one that is probably geriatric and involving the nerves, if we take and we push this dog this way or we push this dog this way, in a young dog that simply has orthopedic pain, they're still going to be strong. They're still going to be able to stand there. Then you can maybe get them to step over a little bit and shift their weight, but they're going to be strong. Whereas if you do that with our friend here, he possibly could fall over. So because he's got muscle weakness. He does have some sarcopenia, and it's oftentimes that these typical geriatrics are also going to have gait abnormalities. So let's look at another patient of mine. This is Boomer. So this picture was Boomer in his prime. He was a hunt test dog. He was the top of his game, at one point. And the client loved to take him out. Boomer loved to hunt. But, by the time he was about 5, he sort of retired from hunting, didn't do very much, laid around a lot, and his body condition score went from a 4.5, which is a great score for an athletic dog, up to a 7 out of 9. And, the owner didn't hunt very much either. The hunt test is actually a competition, but Boomer really did some actual hunting too, but they didn't do much hunting anymore with Boomer because he was really retired. And she noticed that he was limping quite a bit. And so, we don't want to make Boomer do anything too much, so he reduced his activity, he gained weight, and then his limping got a lot worse. So he was prescribed some Rimadyl, but the Rimadyl caused a really bad GI upset. In case you don't know what Rimadyl is a non-steroidal anti-inflammatory, and it's carprofen. It's probably the most prescribed non-steroidal in the United States. In Canada, we prescribe a lot more meloxicam. This client came from the US to see me. But anyway, could not take any Rimadyl, and the owner was really concerned. So we did an exam, and we did some radiographs, and here's Boomer's radiograph, which we've seen already. So he had decreased hip extension, pain, he was overweight, he had some pain in his iliopsoas, back pain, and he was bunny hopping. These were the things that I found. So here's the thing. If we're looking at treating this patient, how about bilateral hip surgery? Well, that's not really feasible for this dog. We could keep him on chronic and non-steroidal anti-inflammatories, but no, we can't do that because he vomits them. And we could try a drug called Galliprant. That's available in the United States, maybe, but I'm in Canada, so I can't really prescribe that. So what do I tell the client? Well, we'll just manage the pain as best we can, and he can't go on any more long walks or hikes, and how good of a quality of life is that for the dog? That's not very good, so we need to do something else. So here's what we did with our friend Boomer. This is Boomer swimming in my pool, and he loves to swim, which is great. So I prescribed some exercises for Boomer, Cavaletti, which is my favorite geriatric exercise. We did some laser with him. We did some underwater treadmill. We did some swimming, and we did acupuncture and chiropractic with him. And this is just a list of, we've used different points with Boomer, but these are some of the ones that we used. At that point, we did electroacupuncture as well. I prescribed weight loss for this dog, and that worked really well. We got him back to a 5 out of 9. We used Purina's OM for him. That worked for him. And I did platelet-rich plasma injections into his hips. And then eventually, we added some omega-3 fatty acids, some Adequin injections, which is a polyglycosaminoglycan, gabapentin, and Flexidin Advanced, which is another nutraceutical. So as you can see, we're doing true integrated treatment. We're using some drugs, well, not too many drugs. We're using some exercise. I mean, gabapentin is a drug. We're using some Adequin, and we're doing a lot of things with this dog. And we got him to really where we wanted him to be. So let's have a look at how do we assess our geriatric physiotherapy patients. We have to make sure that we do a really good general physical exam. So with this patient, what we're going to do is we're going to start with a general physical exam. I like to pain score all of my geriatrics, in fact, all of my rehabilitation patients. We're going to do a gait evaluation, a myofascial exam, orthopedic, neurological, and we're going to do goniometry. So what we're doing here, this is something that's called a gullet. We're measuring how thick this dog's thigh is, and we'll do that again in about 10 visits after and see what we've had as far as increasing. But we do have a whole lecture on outcome measures, so we'll learn a lot more about that then. But what I really want to let you know is that you need to make sure that you do a good physical exam on this dog, because with these geriatrics, we need to make sure we do our due diligence. They need to have had blood work. They need to have had x-rays, because we need to listen to their hearts. If I'm going to put this dog in my underwater treadmill, I want to make sure he's not going to collapse because he's got an undiagnosed heart murmur. I want to make sure that the water's not going to be too warm and that that's a problem because he's got Cushing's disease. So these are all the things we want to not forget, that yes, we're doing rehabilitation and we're doing acupuncture, but we're veterinarians and we're integrative. We're trying to integrate the West and the East. We want to do, our Eastern exam, our Western exam. We want to put all of it together with our gait evaluation. We don't want to forget the muscles. So we do want to do all of these things. So when we talk about gait evaluation, I will do my physical exam, but usually I'm going to do a history first, and then I am going to have the client walk the dog so I can see how they're moving. And the best thing that you can do is video it. Now this little gizmo on the right is called a gait right for dogs, which you can certainly use these things, but they are rather expensive because true gait analysis is by pressure, walkway, or force plate. But you can learn an awful lot just from taking your iPhone or some other video camera and looking at it and grading the lameness. So all of them should be videoed and all the lameness should be graded, because otherwise you don't know how you're doing. This little thing is a static stance analyzer, and I kind of like this. It gives us some information for the clients that they can take home, but still the best thing is going to be your iPhone and your eyes looking at that. You can get some great apps on your iPhone that slow things down, like Coach My Video, and sometimes when you slow down these gaits, you have an idea of what's going on with it. So we're going to look at all that sort of stuff. We're going to do a pain assessment. We're going to make a diagnosis. And then once we've made a diagnosis for these geriatrics, we're going to treat them. And the treatment tools that rehabilitation practitioners have are all of these that are listed there. The ones that are highlighted in dark are really the ones we're going to talk about in this particular lecture. There are other lectures that will deal with nutraceuticals and weight loss, and Dr. Koh is going to be talking about pharmaceuticals and pain. But we're going to talk a little bit specifically about geriatric pharmaceuticals. But this little picture of these two cute little young black pugs, these are not geriatrics, but it's to remind me to let you know that treatment of geriatrics starts with pediatrics, because we really want to start these little dogs on the road to health by maintaining their mobility when they're young and maintaining their weight, particularly their weight, because these little pugs can get overweight very easily. But that's true of all patients. So if we want healthy geriatrics, we have to have healthy puppies. So these are the drugs that we're going to use mostly in our geriatrics, because remember, we're looking at treating a lot of pain and osteoarthritis. So we're going to discuss each of these just briefly, because Dr. Koh has a lot more in-depth stuff. But we're going to look at these from a true geriatric standpoint. So non-steroidal anti-inflammatories are our first line of treatment for dogs with osteoarthritis, and we probably, most of us remember that they're going to inhibit the arachidonic acid cascade, and the issue with that is that you can have side effects, which are going to be GI and that sort of thing, because our prostaglandin is interfered with. But in general, these drugs tend to do a pretty good job of stopping central sensitization in our dogs. So this is really my thought on non-steroidal anti-inflammatories. If we're going to use these in geriatrics, and you can if they're relatively healthy, that class 1 geriatric we were talking about earlier, we want to make sure that we dose them probably lower than we would dose our general dogs. And if you look at, this is the geriatric cat dose for meloxicam, 0.025 to 0.03 mg per kg, and that's once a day. And that is a much lower dose than what is written. Now, Onsior, probably better for cats. With my geriatric dogs, I'm going to go 0.05 to 0.1 milligrams per kilogram once a day with meloxicam. And I'm going to look at my Rimadyl, but I'm probably going to treat that once a day, so the kidneys only see that once a day. So here's the thought about non-steroidal anti-inflammatories. They're good, but they don't do 100% of the job, and sometimes the chronic pain dogs act like neuropathic pain. And I have clients who say they're expensive. What about aspirin? Well, aspirin is it is effective, but it can be really hard on the dog's stomach. It can cause lots of issues, so we try not to use drugs like aspirin. Now, in the United States, there's this great new drug. It is a non-steroidal anti-inflammatory, but it isn't. It's really a piprint, so it's a new class of drug. And this shows you, if you were given corticosteroids, they're going to act in the inflammatory cascade here. This is where our arachidonic acid is produced, and our non-steroidals are going to act here. So they still are going to have problems with our good prostaglandins, if we want to think about that. But this particular molecule, galoprant, works way down here on the EP4. So it's an EP4 receptor antagonist. And the EP4 is a very specific receptor for osteoarthritis. So this is going to cause way fewer problems than the other NSAIDs. It's not going to interfere with the prostaglandins, and it is safe for dogs who have kidney and liver issues, which is a lot of our geriatrics. And this just shows you that the dose is 2 mg per kg once a day. That's pretty much the dose that they were looking at. And they had only very mild adverse events with it. Now, I'm in Canada. I don't have this drug. Depending upon where you are in the world, you may or may not have it. But if you can get it, it is a very nice drug for geriatrics. Tramadol's gotten a lot of press. It does not act as an opioid in our patients, in our canine patients. It does in cats, and it works in us as well. But it doesn't work very well in dogs, certainly not as an opioid. And it doesn't work well for acute pain. And the article that came out in JAVMA, if you've read that one, that says tramadol is useless. Well, they were using it for acute pain, and I would agree it is. For chronic pain, it doesn't work in all dogs, but it does work in some. Works well as an adjunct, and it works as a selected serotonin uptake inhibitor. So it is one that you could use. Gabapentin is probably the #1 drug we're using for neuropathic pain in our old dogs. Many people are not using it properly, and they're not using a proper dose. The dose for geriatrics, you want to start a little lower, around 5 mg per kg, at least twice a day, sometimes 3 times a day. But it does not work on its own. So it needs a helper. You need to combine it with another drug. And it is eliminated by the kidney. But wanted you to see this. So it's a very, very safe drug, and sometimes these dogs will become dysphoric. However, you see the part that's highlighted. Dogs with pre-existing neurological weakness, it can exacerbate the weakness. And you will appear very wise if that happens and you take the dog off of it, because I have done that. Some of these dogs are on it for a long period of time, and then they start to become weaker, and the clients think they're worse, and maybe they are. So I take them off the drug and see what happens. I might put them back on it again, but then at an even lower dose. So the NMDA antagonist, amantadine, is the one that we tend to use in our geriatrics. Some people don't see any improvement when their dog's on it, and the human liquids contain xylitol. Now, the dose that we tend to use in our canine patients is 3 to 5 milligrams per kilogram once a day. And again, it's an adjunct, so it needs a helper. I often combine gabapentin and amantadine with these dogs who can't take nonsteroidal anti-inflammatories. But my favorite drug to combine with gabapentin is amitriptyline. And because where I am, amitriptyline is dirt cheap. I'm treating large dogs. We want to make sure that they're not going to have any issues. Very good for chronic pain. You cannot use it with other selective serotonin reuptake inhibitors, which is like tramadol, so you can't use it with tramadol. But it works very well with gabapentin, and it's inexpensive. And this is a teeny tiny dose, 0.25 to 0.5 milligrams per kilogram twice a day. Tiny, tiny dose. And for some dogs, it works really, really well. And I do get questions about acetaminophen. Not a huge fan of acetaminophen. Some of these geriatrics have underlying hepatic issues, so you don't want to do that. And you can never, ever, ever give it in cats. But I will use it as a bridge. I'll use it in osteosarcoma patients, or if I have a patient that's super painful, no matter what I do, I can't get a handle on it, I will sometimes reach for acetaminophen, and that is the geriatric dose there, 10 mg per kg twice a day. So it doesn't work in all dogs, but not with hepatic issues. So let's talk about the more interesting things about modalities that we can use for our geriatric patients. And this is a list of the ones that we're going to look at: cold and hot therapy, laser, ultrasound, some hydrotherapy, TENS, shockwave, and PEMF. And we will be discussing each of these in detail in other modules. But this is just a little bit of an introduction for their use in the geriatric. And this is my ultrasound machine. I don't use it very often, not since I've gotten a laser. But we do usually use it occasionally for muscle issues. So cryotherapy is very good. Everybody can do cryotherapy, and you can prescribe it for your patients because most people are going to have cold packs available. You can use the cold packs for acute inflammation, immediately post-op, also after exercise or before painful modalities, but it's only really superficial. When I tend to prescribe cold packs, I'm going to recommend that when my patients are going out and exercising, so my geriatric dogs are going for a walk, and if it's cold out, which it is half the year in Canada, we're going to heat up those muscles first in those joints. And usually I just have people heat them up by massage and rubbing briskly, and then take them out, walk them. When they come back, I want the clients to palpate the joints. And if the joints are hot, I want them to ice. So we warm the muscles up before we exercise. We cool them down with ice. Anything that's hot, I am going to ice it. So we're going to do it post-op. We're going to do it after injury. If I have agility dogs, but you know, some of these old dogs it doesn't take much to make their joints sore, but ice can be a huge lifesaver for them. So we use that. This cool contraption that's here in this picture, this dog has Companion Animal Health's cold compression device, designed really for post-op TPLOs and knee issues. We've used it on many other joints because I don't do TPLOs at my practice, but we see a lot of post ones. But if you do, this thing's not a super expensive thing. Very, very good. I will use it in my dog's post-joint injection, so post-platelet-rich plasma or stem cell. And because you might want to make your own ice pack, here's some instructions for doing so. You just need a Ziploc bag. You need some alcohol. You need Ziploc bags, alcohol, something to measure, and a little thing to make it kind of blue so that people realize, oh, this is an ice pack, not just a bag of frozen something else in the freezer. You can use peas, but peas have a lot of air in them, so they're not really the best thing to use. But this is what we're going to do with our icing. 10 to 15 minutes on, 10 to 15 minutes off. You're going to repeat that twice. This is an easy thing to do. Every practitioner can do this. You can do this with every patient that's had surgery and every patient that's hot. You want to make sure that you're going to put a towel between the patient and the cold pack, and it's usually a good idea to take that towel, make it a little damp, and put that between the patient and the cold pack, and keep sticking your fingers under there. You don't want to cause any thermal injuries. So there's other heating methods that we can use. So just as you can use cold packs, you can also use hot packs. We tend to like to get the ones that you can microwave, and then we're going to put them on the patient. The other thing about hot packs, there's a few things about them. No, actually, I'm going to go back here and just... Hot packs are great, so we can use the packs, you can use warm water, therapeutic ultrasound, and warming blankets. This dog is actually in a bear hugger, which is great post-surgery. I'm not sure that I would be using this for my geriatric patients routinely if they needed to be warmed up, but generally we're going to use it post-surgical. So these are the benefits and precautions with thermal therapy. Obviously, the benefits are we're going to cause vasodilation and increase the circulation. And heating things up is great for edema and also for pain relief, and decreasing muscle spasm. We do have to remember that we can't use it within 72 hours of surgery. So if you have a dog who's had surgery, generally that area is going to be inflamed, so you usually want to ice those. And after icing, then after 72 hours, then you can also heat them up. But these are the other precautions. You don't want to heat up tumors. You don't want to heat up... You have to be careful with very old and very young animals because they can heat up more quickly as they may not have enough body fat. They may have very thin skin. You can burn them easily, so you have to be really, really careful. And you have to be careful over areas where the sensation is impaired. And again, it's the same thing. If you have a hot pack, you need to wrap it in a towel. It's best if the towel is moist, and then you use that and put that on the dog, and it can be very, very relaxing. You can use that to heat up joints before stretching, and then you'll get more stretch, more value to your stretching, and that's something that we do as well. So laser, you're going to have an entire lecture on laser, but it's a great, great modality for geriatrics, and it's actually the #1 modality that's used in canine rehabilitation practices that were surveyed. And these are all the uses that we have it. We do use our laser a lot, wound healing and edema, also for inflammation and muscle spasm. You have to make sure that you don't laser over cancers. You don't want to put it in the eye, and in fact, everybody needs to wear eyewear. So this dog doesn't just look like a rock star because it's cool, you know, taking care of his retinas. So everybody who's in the room needs to have that. And in your lecture on laser, they'll talk exactly how it works. But lasers really work by targeting the mitochondria and the cytochrome C oxidase system and increasing energy. And they're going to improve the healing factors and bring the healing factors to that area. And they really do work quite well. I've been very happy with my laser. So other electrotherapies are things like neuromuscular electrical stim, which is really giving us muscle contraction. We use that in older geriatrics who can't get up and can't use their muscles. The TENS machine, which is what you see over here on the other side, that's going to help with pain, but we don't use that an awful lot because research shows us that TENS units only give probably 10 to 15 minutes of pain relief. And since our dogs can't tell us when they're painful, you or I can slap that thing on and, you know, when we're painful again, we turn it back on. But it's not a great thing. You also have to shave your dog to do that. So it may be okay post-surgical, but other than that, there's not a huge use for it in veterinary medicine. Now, pulsed electromagnetic field therapy is something that's been around for a while. This particular device that's on here, this is called an Assisi loop on all of these patients. It's something that we've used a lot in our practice. The Assisi loop has some great evidence for its use. It was originally designed for women post-mastectomy, so it can be used in cancer patients. It can be used in many other type of patients, but it's something I like to send home with my clients because they can treat their pets at home with this, and it's extremely safe. They can't overdo anything. And the people who make the Assisi loop just published a couple of interesting studies. But this is one that was published on targeted pulse electromagnetic field therapy, comparing it with nonsteroidal anti-inflammatories, and it works really well. If you're interested in reading this paper, this is not the new one from Assisi, but I will provide that in our notes, the paper, so you can look those up if you wish. But it compared with NSAIDs, actually it worked significantly better in a lot of these patients. So it's certainly something to consider, something you can sell and send home with your clients. Now, a lot of these geriatrics in my practice are getting into the underwater treadmill because we are wanting to help with the underwater treadmill gives us buoyancy for them and hydrostatic pressure. So it's holding them up, decreasing the pain on their joints. It's nice warm water. The pressure helps with edema. And because it's a treadmill and they're walking, it gives them stimulation. So with our geriatrics, osteoarthritis, old dogs, you know, with weak back ends, it's great for strengthening. We use it for muscle weakness, and we'll use it for weight loss and just conditioning as well. But we tend to use a lot of different things. We'll use toys. Sometimes we'll take peanut butter and smear it on the front of the door of our treadmill to keep the dog interested in walking forward and getting a little lick of peanut butter. This dog kept wanting to put his head down, so we have a pool noodle around his head because he's got a cervical issue and we want to keep his neck up. But he did like to hold his ball, so there's all kinds of tricks that we use for that. Now, swimming is something that can be good for geriatric patients, but the issue with swimming is it tends to be a very high cardiovascular activity. And for general conditioning, it's a non-impact exercise. So if you have a dog that's had a ruptured cruciate or you're trying to get more weight bearing on a leg, swimming is not the way to do it. It is good for dogs with general arthritis because it gets them to move their legs. The water is nice and warm, at least it is in my pool. Good for rehab of the forelimb and to help strengthen core. So for those back dogs, once you're trying to prevent issues with them, it's very good. But thinking about that therapy pools should be warm. On average, 82 to 88 is the ideal temperatures for geriatrics. Obviously, if you're conditioning dogs that are canine athletes, you may want to have it a little bit cooler. But most of the dogs that we're looking at, we're doing this for rehabilitation therapy, and many of them have arthritis. So those are the temperatures we like to keep the water at. Now here's just a list of exercises, and these are my favorite geriatric exercises. We will have some information on exercise therapy, but this is just to get you thinking about these. And we'll look at some of these. Cavalettis and then weave cones. But cavalettis are my favorite exercise. This is where you're having the dog walk over little poles that are held up by cones or something else. You can use hockey sticks. Client who decided that she was going to make some out of pop cans, squish the pop cans down and then put a pole over top of that. But she also told me that the beer cans worked way better than the pop cans. So anyway, I don't know about that, but you can do that. Weave cones. I had a client who wanted to use something for weaving and for some reason couldn't find a cone and decided to go to the dollar store and buy 6 plungers and put those standing up so the dog would weave around those. So it depends upon your imagination. So those two things definitely we like. Backwards walking, we just teach the dog to walk backwards. Best exercise for the hamstring muscles particularly. High fives obviously for the front leg. Uneven surfaces, I have Bosu here, that's the half exercise ball. But you can use any other uneven surface. You can use cushions, you can use like couch cushions, you can use mattresses, you can use many of these things. Cross-legged standing, great exercise for core, and then sidestepping is going to help in hill walking. So this is our cavaletti. The idea is that that the dog is going to walk over this, and when we do that, it helps with flexion and extension. It's going to build some strength, and the height's going to depend on the height of the dog and the ability of the dog. So those are the exercises that we would use. And I don't know how many of you are practicing acupuncture, but acupuncture in my hands is one of the best things that I can use, particularly for pain relief for the geriatrics. But it's going to help with muscle tension, inflammation, going to bring a lot of healing factors to them. So we do lots and lots of acupuncture, and our geriatric patients like it. It's a non-drug option. And because I also practice with herbals, I frequently combine it with traditional Chinese herbal formulas, because I find that in my thought, herbals are like acupuncture in a bottle. And it tends to get my acupuncture to last longer, and I'm very happy with it. They're very safe. There tends to be not a lot of issues with the herbals with my patients. Some of them will get diarrhea, but it's not like you're using a non-steroidal anti-inflammatory, which is going to cause a GI ulcer. So assistive devices that we use. So these are some of my favorite. This dog is again in the Help 'em Up harness, which we talked about a little bit earlier. And of course, what we're trying to do is get him to bear more weight on his back legs. So we're holding him up with this ball and rolling him back and forth just to get a little bit more weight bearing. You can see we have booties on him because this dog was paralyzed in his back end. And so he was scraping his feet, so we're using that. But there are very many things we can use. Canine mobility anti-knuckling devices, we'll have a look at that. Power socks, booties, wheelchairs we use, ramps, and also some medical pet shirts. Now this is, well, that one works. So this is something called a canine anti-knuckling device. It's really just a harness with something that I would call therabands attached to this dog's feet. And it's just helping, because this is a dog, an old Great Dane, not that old, but he has DM, degenerative myelopathy. So he is knuckling on his feet. So as you can see, so these are pulling his feet up, so it doesn't let him drag his toes. So then booties are something else that we use a lot of. We will use those. And then this is a little dog in a wheelchair, but this is a walk-in wheels wheelchair. So this is a temporary one. We have some of these in the clinic because we want to know if the dogs, if they really need it, if it's going to help them. So rather than have somebody go and order an expensive custom wheelchair, we'll start with these temporary ones and see how the dogs do. And this is just to demonstrate for you medical pet shirts. So this is a dog. We'll see he's on my tech scan mat, which is for gait analysis. But we just have him on there because we have a yoga mat over our tech scan to keep it clean. But as you can see, this dog is quite ataxic. He has a T3 L3 myelopathy. So we put this little medical pet shirt on him. I'll show you the next video on that. And it's the idea of that is like a Tellington touch, connecting the front of the dog to the back of the dog. So it just basically does that. And here he is walking, same dog, same time, and he's walking much, much better and the only thing we did was put this shirt on him. And so anyway, that's something we can do. So other assistive devices, well, we've already talked about the wheelchairs, and this is a help 'em up harness with a little handle on the strap so that it's easier for the person to get the dog to move and not bend over themselves. So orthotics are another thing that we can use and that we do use with our patients. And it's something that I use with a lot of geriatrics. Now, this is a dog that's had a cruciate rupture, and we had this custom orthotic made for him so that he did not have to have surgery. But we will often have orthotics made. Many of these older dogs, Shelties and such, will have carpal problems, and they need to have some kind of a custom brace because their ligaments are degenerative. This is what happens with them. Their ligaments will degenerate, and they need a little bit of support so that they can walk around a bit better. These are a couple of companies that I have used. There are many other ones, but we have to, the custom orthotics are expensive, but what we do have to remember is that the cheaper is not better. The custom ones actually work a lot better in my hands than the other ones do. So I'm just going to finish this lecture by going through a few cases so you can see some of the patients that we have done some geriatric rehabilitation on and how that has worked out for them. This is a dog by the name of Prince, and Prince is an 8-year-old Siberian Husky, and he had some arthritis and ended up with cervical disc protrusion, and he was paralyzed in all 4 limbs. He did have surgery. He had surgery done at the University of Guelph up in Ontario, and they told him that the surgery was successful and sent the dog home. However, when the dog went home, he was not walking. And the neurologist said, well, that's fine because you need to just cage rest him for at least 6 weeks and he should be fine. So they cage rested him for 6 weeks and he wasn't fine. He could not move. And so this is one thing that unfortunately there are surgeons still in the veterinary community who do not know anything about rehabilitation and do not recommend rehabilitation. Like, these dogs need to be up and moving. Of course you have to let the surgery heal, but 2 weeks of rest is generally all that you're going to need. But anyhow, so this guy, 6 weeks, he still wasn't any better. So then the neurologist said, well, perhaps what we need to do is finally send him to rehab. He lived quite a ways from us, about 7 or 8 hours. So they actually left him with us for a month. So this was the first or second day that we had him. You can see all of the contractions that he has here. I have 2 therapists in my treadmill with him. We have him with the sling. We're hanging him up. We have the treadmill going, and we're making him move his legs because this dog did not want to do anything. Now, we're in Canada. He's a Siberian Husky. Not only did he not want to move, pretty much his nervous system had forgotten how to move, but he was depressed. This dog liked to be outside and liked to be active. So after we got him moving a little bit more, we took him outside, and we have a harness on him, but you can see she's holding him up there, but you know what? He can move, and he can move his tail, and she's helping him, and he's moving his legs, and he really liked to be outside. So one of the things that we did with him was we took him outside in the snow several times a day. And snow is a really good thing. We have a lot of it. If you don't have snow, you can use something else. This dog would have done fine if he was walking on sand. So you could walk him any, sand, deep leaves, anything like that. But you can see that he, in this case, doing much better. So here's our next video of him, and this is about, he'd been staying with us at this point about 3 weeks. So now it only takes one therapist. She's just balancing him a little bit, and my gosh, he's walking on his own. So he's doing pretty well. And this was him just as we were sending him home. And I mean, he's still not 100% normal, but my gosh, this dog was flat out when he came in to see us, this old dog. And now he's very, very happy to be going home with his family. So these are things that you can do. Now, when we sent him home, we didn't just send him home and say, you need to have a nice life, take your dog and go home. But what we did say was, these are the exercises that you need to continue doing. This is what you need to keep doing with your dog. And we recommended that he do some acupuncture. So I showed you the underwater treadmill, and I showed you him walking. But we did many other things with him as well. We did some acupuncture with him, we did exercise therapy, and we did some laser, as well as getting the dog up and moving. And we got a Christmas card from them the next year at Christmas, because it was close to Christmas time when he was in to see us. And he's done really well, and they told me that he's continuing to do acupuncture about every 6 months. So we need to think about that. So this case is very, very interesting. This is Finnegan. Finnegan is he at this point was a 5-year-old miniature poodle who had severe osteoarthritis, carpus, tarsus, and it was immune mediated. He was unable to walk or go up and down stairs. His appetite was decreased. He'd been on a non-steroidal anti-inflammatory, and he'd also been on prednisone, but he couldn't take either of those, and the owner didn't like the side effects. So what should we do? Let me show you. This is a video of him walking. This is horrible. Look at this poor dog. He cannot move without pain. So you need to think about what are you going to do with this dog? Poor guy, poor Finnegan. So here's what we did with him. We did a few other things, but one of the things that we did was we put him in 4 orthotics. We put him on those, as well as we treated his pain with some herbals and with some acupuncture. And so this was Finnegan when he first got those orthotics on. He's doing pretty well. He's walking pretty well. So Finnegan has been a long-term patient of mine and is now about 12 years old, still wears these braces. There's issues with braces that you have to worry about rubbing and that kind of stuff. But the other issue for Finnegan was that if we didn't do something like that, euthanasia was the other solution. So she's been very happy to continue with him. That ends our geriatric rehabilitation unit. If you have any questions, please feel free to email me or just post a question in the discussion board of the course.